I would check my doctor's orders and make sure that trach care is ordered. Then I would knock, walk into the room. Hi, no, I'll be your nurse today. Perform hand hygiene. Start putting on my gloves. Ask them their name, their date of birth. Verify that against the MAR for the record. Then I would want to assess for pain. If they were in pain, I would want to pre-medicate. I would tell them that if any time during this that they felt like they couldn't breathe or anything, to let me know, and that we would stop. I'd let them catch their breath, try again. If they still couldn't catch their breath, we could try again later. I'd ask them if they had any questions about what I was going to do. I'd explain to them what I was going to do. Make sure that I had suction set up and a valve bag mask ready. I would want a full set of vitals, attach a pulse ox. Then I want to listen to their lung sounds, get the top ones, include the lateral fields. I would assess their respirations, any sign of dyspnea, shortness of breath. Then, while I still have this on, my clean gloves, I would open my package, remove these sterile gloves because I'm not going to use them, so we're going to throw them in the trash. Then I'm going to pick up my sterile field by the borders. Unfold it. Place that down. Then we're going to take our supplies. Dump them out. Return this. We're going to take our saline. It's brand new, so don't have to lip it. If it was used, I would lip it, make sure it was in date, lip it, then pour it in. Pour it in all 3 containers. Hydrogen peroxide, same deal with the hydrogen peroxide. Brand new, so I'm going to open it, pour it in the big container, 50-50 mixture. Okay, we're done with those, so we're going to leave those there. Then I'm going to come over here, I'm going to assess their oxygen, remove their oxygen from their trach. Then we are going to remove the inner cannula. Still assess their respirations. Then we're going to drop this in the mixture. We're going to remove our clean gloves. We're going to put on our new sterile ones. Still just touching the borders. My package was moving, but I held it by the borders. Only touch by the borders. Make sure you don't touch the rim of the glove. Okay, now that we're sterile, going to pick up our inner cannula, dip this into the saline, clean the inside, clean the outside, discard the pipe cleaner, agitate this in the normal saline, use different pipe cleaner, dry out the inside, discard this. Then you want to take the normal 4x4, draw off the cannula, discard that. Then your non-dominant hand is going to become unsterile as you insert the cannula in. Your right hand stays sterile, and you twist it until you hear a click. So then this hand is no longer clean. We're going to, with the unclean hand, we are going to remove the old gauze. This hand is still sterile. We're going to grab a Q-tip, dip it in the normal saline, clean the base of the trach, discard, grab another one, normal saline, clean the stoma of the trach, discard. Then we are going to take our new gauze. We are going to insert it back around the trach collar, like so. Okay, and now that that is on there, we want to take our string, insert that through, make sure they're about even, support their head, move it around. Then we're going to tie this together, not wrong, not on their carotid, more in line with the ear. Okay, make sure that that is secure. Then we're going to want to find the old tie. And remove it and discard this into the trash. So now we're going to remove our sterile gloves. We're still going to be monitoring the respirations, their O2, make sure that everything's okay. We're going to discard our sterile gloves in the trash. Then we're going to assess our patient again. We're going to ask them if they're in any pain. We're going to check their respirations and everything. We're going to do full vitals. Then we're going to auscultate their lung sounds again, including the lateral fields. And obviously you would put on clean gloves before this, just amount. So, and perform hand hygiene. And so, then we're going to want to reattach their oxygen, ask them if they need anything. They said they weren't in pain, so then you would lower the bed to its lowest position, make sure their side rails are up, and tell them that you will be back. And then we would clean up our mess and get rid of the supplies.